And as we have some of our newer doctors joining us now, and then we'll go to introductions. I'll kind of just give them a general overview of what this AMA is about. So we'll start in, I want to say maybe seconds, and we'll let some of the new doctors join us. Awesome. So it looks like we're a little bit past the top of the hour here. I want to thank all of our newer doctors for joining us here tonight for our new Doctor Ask Me Anything session. So this is pretty much just opening up the floor to all of you to answer your questions, addressing your feedback, and providing insight on your concerns as you get acclimated within your first 90 days. So your first few months with Aspen Dental. I have Dr. Pravin here with me tonight as our panelist. He is part of our clinical support team. Many of you have submitted questions already, so we will be addressing those. If I'm looking to my other screen here, it's just going to be me circling back to some of those questions that you guys submitted. And then you also have the opportunity to ask questions live on the Q&A box below. You're able to type in, submit some of your questions that you have that come top of mind as you're on the session as well. So just in case you didn't submit any questions beforehand, you still absolutely have the opportunity to ask the question live as well. So anything that comes top of mind, please, again, this is us opening up the floor to you. We have some amazing questions that you guys have submitted, so I want to thank you for that as well. We're going to do some introductions here. So my name is Miles Murphy. I am on the academic team. I cover the PA, Maryland, and DC area. Pretty much what I do is I build relationships with the dental students, connect with the schools, and just educate the students who are interested in post-graduation opportunities. So I'm their Aspen Dental tour guide, and I assist with the recruiting efforts as well. So I do pretty much everything academic related. So without further ado, I'm going to open up the floor to Dr. Pravin. I'm going to let him introduce himself, and then we'll dive into some of these questions. Thank you again, new doctors, for joining us, and we'll get this session started now.
Thanks, Miles, and thanks, Doc. I know you all had a busy day. Thanks for joining this. I'm Dr. Pravin Chalamuthu. I'm the Director of Clinical Support in Dr. Judge's team. Been in Aspen since 2007, worked in 5 different states as MCD, ran successful practices. About 4 to 5 years back, Dr. Judge approached me and said, hey, do you want to join the clinical team? And, so I said, yes. So my role is to support the doctors and the teams and make sure that, we are successful. And pretty much my goal is to help the doctors reach their goals. And so I asked the doctors, hey, what is your goal? Where do you see yourself? And, I partner with ops and other team members in PSC to help you guys achieve those goals. And some of you I might have met during Discover Aspen virtually. Some came to the retreat, I might have said hi, but that's who I am. Literally, we're here to support you and make sure you get to your goals.
Awesome. Thank you so much, Dr. Pravin, for your introduction. I want to transition. You just pretty much said what you do and how you support our new doctors. We did get a question in that's pretty much touching the surface on how they can reach out to you. So we got a question that said, how can I further utilize the clinical support team at Aspen Dental? So if they are a new doctor within their first 3 months, what are the steps that they take to reach out to someone like you or someone else on the clinical support team?
Yeah, this, like docs, I just tell this to everyone, there's no question too small or too big. You can always reach out to us. Sometimes the answers may be with other team members, but what we could do is help you put you in touch with those team members. If it's clinical per se, we handle it one-on-one. We help coach on leadership, team building, how to manage people, things like that. So the metrics and the business side, there's no like for what you should and shouldn't reach. We are literally your partners for everything. If at all there's a question, feel free to contact one of us and then we can guide you in the right direction. So I don't know if that answers your question per se, but regardless, like you have your regional manager, director, DVP, and everyone should be supporting you in the right way. And if it's clinical, they might ask us to get involved. If you're working with an owner doctor, usually the owner doctor does what we do. So the owner doctor supports their doctors. But rest assured, if you want to reach out to us, you have any questions, feel free. Some of them ask questions, or if we have any CE programs, things like that. And I tell them we have a lot of CE programs housed within Aspen. If we don't, we would like to hear from you. And if enough doctors want something, we create programs for you guys. And so we're always looking to hear from you. And if there's any questions, and we can improve our support for our doctors as well.
Awesome. Thank you, Dr. Pravin. I want to shift gears a little bit here to mentorship. So this is just working with students personally. This is on the top of the list for all students, all recent grads, even some of our more experienced doctors. Mentorship is really, really important to them. So regarding the doctor development plan, what are they supposed to expect for their first 3 months? Or we can even go a little bit further here, their first 6 months with Aspen Dental. What does that look like for our newer doctors?
Yeah, we actually are revamping our mentorship program. So, but I'm going to talk about what exists in the field. And, like we see more and more new grads coming in. We want to be best in class when it comes to supporting our doctors, have the best programs. And to that end, like we just moved into this new building, 800 Fulton Market, which is 18 floors. We have 10th floor to 18th floor. So we've designed 2 floors designated to train and develop our team. So that's some fun stuff. In 2022, we're going to launch our new doctor development roadmap and the program that's going to come ahead. So we're also opening up the old building that we have in Chicago. It's going to be converted into a clinic where doctors can come in and actually do, dentistry. So it's not just CE courses, but it's also going to be live patients right next door. We're going to give back to the community. And so that is in the pipeline. So what to expect today is day 1 and day 2 is going to be getting used to the Aspen environment. You're going to meet with the CEO like Bob Fontana and our Chief Clinical Officer, Dr. Judge, operational heads, Gina, Laurie. So that'll be day 1, day 2. And then the next 4 weeks, it's going to be custom for each doctor. You might have doctors coming fresh out of dental school. So for them, it's going to be more shadowing the mentor doctors week 1. It's getting to know, okay, how things are done in Aspen, the different chairs we have, different positions. They shadow different positions just to understand what's happening in the office. What does a PSR do? What an OM does? Hygiene, DAs, lab tech. So that it's mostly shadowing week 1. Week 2, 3, 4 is designed a little bit custom based on what the doctor's comfortable with. So doctor gives a sheet on, okay, these are some of the things that I'm comfortable, and these are some of the times that will work for me. And so it's going to be a hybrid of taking up simple procedures like simple extractions and fillings and things like that. As they get more and more comfortable, they're going to do more and more complex procedures. And hopefully the mentor doctor, and ideally the mentor doctor, is now shadowing the mentee, suctioning and seeing them and helping them and guiding them. And so that should be the ideal process. But some doctors have experience, so probably they jump in quicker into doing more complex surgical procedures. That should be the ideal transition. And again, it's a bell curve. Some doctors, after 4 weeks, they can go and run their own practice, but some doctors need a little bit more mentorship, in which case they might be the associate doctor. They go into a practice where there is a lead dentist and they're continually learning from them. This is kind of like the basic roadmap. So the doctor can get really good at comprehensively treatment planning and case presentation, and then extractions, dentures, and all of the blocking and tackling. The next level would be getting implants, getting clear aligners. So implants, the way it's designed is you have Continuum 1 and Continuum 2 that you're going to do at your own pace, which is a web-based learning. Continuum 3 was designed to be in Chicago, which is a hands-on program before the surgical program, where you learn to read CBCT's treatment plan, implants, restore single implants with open tray, closed tray method, and also learn how to pick up housings on complete denture cases. So that was Continuum 3. And you go back your treatment plan, you restore a few cases. And once you're comfortable, you raise your hand, then you go to the surgical program in Mexico or Alabama. The last group that went placed 300 implants, about 30 implants a doctor. So it's a phenomenal course. So every step of the way, as you raise your hand, you could do more and more. And so that's with implants. And then you have Motto, which is our clear aligner. So you could go through the clear aligner program, get certified to, prescribe clear aligners as well. And this continually is happening in Chicago online as well in a blueprint learning. And that's kind of like a brief roadmap. And it's based on the doctor's progression at every level, how fast they can go.
Awesome. Thank you, Dr. Pravin. Yeah, you kind of just touched base on all the CE that we offered. And that's a common question that multiple doctors have submitted. And I get that question all the time with my students as well. So CE is really, really important, and it's on the top of mind for pretty much every single doctor out there. I want to stay on the CE kind of subject here. And there's a question that goes a little bit more specific here where it says, is there a way to track the number of procedures we've done, specifically the amount of extractions, so I can sign up for implant training? I see you smirking over there. Is there, do you have the answer?
Absolutely, yes. So everything you do is charged out under your credentials. So that is how we track. Actually, before someone goes from Continuum 3 to the surgical implant course, we have a point system. It's a 10-point system. And one of the criteria is how many surgical extractions you've completed. And so you get a point based on X number. I believe it's 1,000 surgical extractions before you get that point. Also, if you have a CBCD in the office, if you've restored implants, if you placed a couple implants, so you've done socket preservations, it's a owner doctor office, so there's multiple things, and you have to at least get 6 points to qualify for that. And so to that question, absolutely, you can pull any data, that we want, how many crowns you've done. So you have a specific clock-in number and a charge-out number. So based on that, as long as it's being done accurately, I know sometimes you have two doctors in the practice, and if you do the insert and it's accidentally charged with the other doctor, there might be skewed. So making sure that you are the one who completes your notes and charge it out, as long as that's done accurately, we can pull every single data that's out there for every procedure.
Thank you, Dr. Pravin. We had a question regarding mentorship. We'll kind of stick on that subject here. If let's stay with the associates out there, right? The newer associates for mentorship, are they going straight to their MCD doctor? Are they reaching out to the clinical support team directly? What is the process regarding that?
So it's kind of a combination where the clinical team works with the operational team to understand which state the new doctor coming is from and where they are licensed at, because we want to make sure that the doctor going in is licensed in their state, so where they can work and the mentor doctor can observe them working. That's one. And we have a lot of doctors joining. So at that any given point, based on where they're coming, ideally what we want is we want them to go to a different location to get mentorship, because they are going to be with their doctor and learn through the process. And so we want them to go to a different location, see what it looks like, and then come back to their office. So that's mostly what's going to happen. But are there situations where you directly go to your office for mentorship? Absolutely, that can happen as well. We do hire about 600 doctors every year, so you can understand it's not as easy to make sure that every doctor gets a particular mentor doctor. But all the mentor doctors do go through a mentor doctor training program, so we can keep it uniform across the country. And like 98-99% of the time, you're going to have amazing experiences. Of the off chance, if there's anything that is not going right, please reach out to us so we can make sure that you can get that amazing experience from your mentor doctor, so we can coach and develop them as well.
Awesome. Thank you so much, Dr. Pravin. We got a question that was submitted beforehand as well regarding what resources do we have available to learn how to effectively use EPMS or clinical resources? Are you,
So yes,
if you want to go ahead and answer that? Yeah.
yeah. So it's kind of a little tricky right now. So for people coming in, EPMS is our own software. So we didn't purchase it from somebody. We have our own IT department that's developing, and this question has come up multiple times. So we haven't created exactly the full-on how to use EPMS yet, because it's going through different transitions. We had rollouts of EPMS 1, 2, 3, and we're always updating and making it more user-friendly for the doctors. As doctors give us feedback, we are updating it. So, we don't want to keep putting out a module on how to use EPMS and then it's already obsolete. So we're pretty close to completing all the things that the doctors have asked from us. And we're in the process of creating that module, so it's easy for doctors to do that. So just be patient with us, and it's going to come out soon. In the meantime, if you have any questions, your regional manager, director, or your mentor doctor should be able to answer them. But if you're not able to get in touch and get answers, feel free to reach out to myself or any of the clinical team members, and we will get you those answers. Also, if you have feedback on, hey, this could be better in EPMS, let us know so we can go back to the IT department and say, hey, these are some of the things doctors want. Can we create those for our doctors? So we are in the process of making it perfect for y'all. And so just bear with us before we create that module on how to learn EPMS.
Great, thank you, Doctor. I want to shift gears a little bit here to metrics. I know that we kind of touched upon, is there a way that they can kind of track the number of procedures they're doing and what procedures they're doing? What if they wanted to know just how to read the metrics and details? And, if they want to, the specific question is, they would like to understand the metrics in detail and also wanted to understand the overall roles and responsibilities of the org. Is this something that they're speaking with operations with? Is there something that they're
actually
with? Is it
as
both?
a matter of fact, after Discover Aspen, they have a series of Beyond the Chair sessions. And one of the Beyond the Chair sessions is metrics. Actually, I do that presentation. And I actually go over line item by line item. And as you see the metrics page, the way it's designed is it's based on demand, how many new patients are coming into your office. And then it goes on, completion, what we're doing with the new patients, how much are we, like the treatment planning and the acceptance, and then how fast are we doing these procedures. Then it goes to finances on, how much are we generating, what is the deposit, those things. And then finally, patient satisfaction. So there's a way the metrics page is designed, and I go over each line item, and I also associate it with behaviors in the practice. For example, if you don't have new patients showing up, your show rate is like below 50%, right? Immediately, how do I perceive that somebody's not owning the welcome calls? And offices that have good show rate above 70%, we see that either the PSR or the office manager is owning the welcome calls, calling all the patients, letting them know what to expect, getting them excited about showing up to the office. And similarly, one of the biggest questions I hear when I go to offices, oh, people don't have money. But how do you actually read and know what's happening? Is you have a credit apps, percentage of credit apps in your metrics page. When somebody says that and I see the percentage of credit apps is 15% and OTC is low, where they're not giving cash, I know our patients are not being offered credit applications. So credit app percentage just tells me how many people we applied for. It's not about whether they got approved or declined. And so immediately I call the office manager out. I said, if you really think our people don't have the finances, then you're not breaking down the barriers to give them means to accept the treatment, which means you're only giving 15 people out of every 100 the opportunity to apply. So I'm going to challenge them. So definitely we will go through all the line items, helping you understand what the metrics are. The goal is, as a young graduate coming in, we want doctors to be good in dentistry, and then slowly we add on business management and people skills and leadership skills.
Awesome, thank you, Dr. Pravin. Let's transition a little bit to scheduling. I know that this is a topic of discussion for a lot of doctors, because I can see the frequency of submissions here. We got a lot of questions and feedback regarding scheduling. This may be more of an operations question, but just if you can answer it as best as you can. So they're scheduling issues in a specific office. Their office manager has changed the start time to their office without telling them. They're lighting on mornings. Is this something that they go to operations for? Is it something that they talk to directly with their office manager? In your opinion, Dr. Pravin, what would be the best for that doctor to handle that situation?
Yeah, like usually anything that can be resolved in the office, I would try to resolve in the office. So I would sit down with my office manager and be like, hey, what happened here? Why did we change the times or whatever it is? And try to get to if there's a reasonable explanation. So one, like I said, there are two important things. One, we take care of our patients all the time. Number two, take care of our people. So if there are some challenges for some of our team members, we want to be accommodating. But if there's a challenge for you as the doctor in those times, then we need to make sure that the teams understand, hey, there are some restrictions for me as well. But it should be a group team decision when something like that, changing times are taking place. But if you're hitting a wall and you're not getting answers from your office manager, then that's when you go to your regional manager or your owner doctor. If it's a POP office, I would go to the owner doctor, just get them involved. It's all about communicating. And, the best advice I could give is, be polite, be nice, and, just tell what your concerns are and help them understand. And so it becomes a group decision where we can make that, okay, so the doctor cannot come in a certain time. So as a team, what is the best hours to keep it open? So the question was regarding the office hours, right? Am I right?
Yes. Just basically, if there's a miscommunication regarding the office hours, or if they were scheduled during a time, the office manager changed the start time or something like that. It was just pretty much the office manager changed the start time, and then telling the doctor. So the doctor just wanted to know what's the best way to go about that. That's pretty much.
So meaning ideally, I would like to give the office manager a chance to explain what happened there. And so hopefully it could get resolved. And if not, then we have the regional manager. You can always, go to the owner doctor, and you can reach out to the clinical team to help if you need any, if you're not getting results. Absolutely.
Yeah, awesome. Thank you, Dr. Pravin. So this may be more of a MCD question. It may be an associate question as well. From a clinical perspective, you'll be the perfect person to answer this. Tips for time management and managing multiple chairs. Dr. Pravin, what are some of your tips to a doctor who are managing multiple chairs, seeing a lot of patients per day? What would you say is the best way to go about that?
That's a really good question, because I remember, like I graduated, I was an associate for a month, a position opened up, and then I was asked to be an MCD. And so trust me, like I remember those days, if I broke a third molar and I have to dig a root in and you have 4 patients waiting. So there are days where I used to wake up and be like, I hope I don't break any roots today. I don't want 8 people waiting for me. But the time when things changed was, one, I realized, you know what, I'm just going to focus on the patient in my operatory, give them everything. I'm not going to focus on who's outside. What is the worst that can absolutely happen is we reschedule somebody, so what I really want young doctors to focus on, new grads, is focus on the patient that's in the chair, make sure you take care of them, and then move to the next one. So that's just making sure that you're not panicking, right? But there's also another thing, making sure that you're efficient as well. And there's a multiple chair column. So understanding, okay, you come in the morning, you have 3 patients. What should I do first? If you have like a filling or extraction or a procedure patient, new patient, and denture step, so you can't go into like the new patient and then do a denture step and then go to numb the patient. So we all know numb the patient. So as they wait, you could do the other thing. So just making sure you understand the sequencing and training your dental assistants to be traffic controllers, just helping you understand, okay, doc, you have X, Y, and Z, op 1, 2, 3. So mentally, you know which one to go in. Also, if you have a new patient that's just a denture patient, it's relatively quicker, so you could go in and out and things like that. So you have to kind of learn how to go from op to op and maximize that. Also training based on the state, what the dental assistant can and cannot do. In some states, they can make TEMS, they can take the permanent impressions, things like that. So maximizing your dental assistance as well is key from going from op to op. So start from, the key thing is to get better at each single procedure. If I take 2 hours to do a crown, my goal is to get it to 1 hour 45 minutes, then get it to 1.5 hours, possibly even get it to 1 hour. But I'm continually working, how can I get better? So it's not just improving my speed, but also maintaining the quality of work. If I prep the tooth too fast and then I have to do a root canal, then that's not the right thing. So slowly give yourself challenges to get better and get faster at the procedures, but not compromising on quality of the care is key to being able to go from op to op. So once I became really proficient in doing extractions, that used to actually be the procedure I loved, because I would go in and take it out in like 2-3 seconds, which gave me half an hour to catch up on other things. So just, getting better at the procedures so you could go from room to room.
Thank you so much, Dr. Pravin. I love that answer, because there was a couple things that you threw in there that I wanted to kind of touch upon as well, regarding the transition from an associate to an MCD, and then also what a dental assistant can and cannot do. I know that is state specific.
Yeah.
But we did get a question that they just want to know what their dental assistants can and cannot do. They're in Oregon. I'm not sure if you know
I'm not.
what they can do. If not, do you know the best way to find out that info?
Yeah, so like we have a team that can tell you exactly what the specific regulations are. Just shoot me an email, and then I can reach out to our compliance department and risk, and they know all of the regulations. But in general, anything that is permanent cannot be done by a dental assistant. That's regardless of which state you are. There are some states that have expanded functions that can do some fillings and stuff. But for me, it was like anything that's going to be permanent, I wasn't comfortable. I wanted to make sure that I'm the one who's doing those kind of things. So anything that is temporary, most states allow, like they're allowed to do temporaries. They can take an alginate impression. They can take the initial scan, things like that. So based on your state regulations, I would maximize my dental assistant capacity, train and develop them to do it, because the doctor time is the most valuable. And as much as you can have the DAs do all of that, you're just going in to prep the tooth, and then 90% of the things are done. You're just going to place the impression maybe, or just go for a second scan over there, and then they do the temps. You're just going to go back, check the temp and cement. So making sure your life is a lot easier. But specific to state, if you'll shoot me an email, I can get you those specific what DAs can and cannot do.
Great, thank you, Dr. Pravin. The other part of the question that you kind of touched upon regarding the transition from an associate to an MCD. I know that your tenure as an associate was pretty short-lived. You mentioned that you weren't an associate for that long, right? So for that newer doctor, straight out of school, or even if they aren't right out of school, if they did start off at Aspen Dental with as an associate, what is the path to being an MCD?
Yeah, there are things that I just out of personal experience, and my sister's a dentist, and I brought her into Aspen as well. And a couple of things I would like to let the doctors know is, don't rush into being an MCD, because an MCD role is not just dentistry. Because before you get into an MCD role, you should be able to troubleshoot any given situation, right? You break a tooth, you should know how to get it out, or you have a challenging case, because there may or may not be another doctor to ask questions in the practice, right? So now you're the lead dentist. So when you think about being an MCD, one, you should be proficient, at doing some of our core procedures, at least, not necessarily you have to do an impacted wisdom tooth or a molar root canal, but at least the core things, all these extractions, fillings, dentures, doing a comprehensive treatment planning, getting the basics right, and in a time efficient manner, right? So that's the luxury of an associate position, is you don't have as many columns to juggle. You probably have your procedure column, and then if you're free, you're going to see some new patients or the overflow denture column. But what is expected is mostly the procedure column, and you're a little bit comfortable. Number two, you're not worried about if there's any, employees between the front and back, if there's any confrontation, you're not expected to make decisions. So you're focusing on dentistry and not on, the people skills or leadership skills or the metrics portion on, okay, is the business successful? So once your dentistry is really proficient, then you can raise your hand and be like, okay, I can manage all the clinical situations. I'm ready to be an MCD. And then we can train you on, okay, if there's some people skills, how do I manage and motivate my team? We can train you on that. Some of the leadership and business skills, we can train you. Hopefully as you're getting better at clinical, you're getting a little bit of the business management, the metrics. Okay, what are the behaviors that drive the practice? At what level is my practice successful? What is the break even? Because as an MCD, you have to know your business, right? Like, although, we don't tell, you don't have to worry about, okay, how much do we need to make to keep the lights on, which is the best part about Aspen. You have the luxury of coming, working, and getting to know dentistry. But at a certain point, when you're thinking ownership, you have to start looking at the profit and loss P&L statements and understanding what is the break even for me to be profitable at this location, and things like that. And so, okay, we do have some budgets that we put in. So what does that mean? And things like that. So just to be an MCD, I would say get really good at dentistry and then start learning some people skills, because to be successful, you need to have a strong team to be successful. So I've worked in different places, and the most success I had in Rhode Island is because the team was efficient and was able to do. And so then I realized I have to coach and get my teams there. So that's what a good MCD would do. And then as you go into ownership, then it's a lot more business than clinical and, other things.
Dr. Pravin, I wanted to take it a step further as well, because I love that you mentioned ownership. We did get a question regarding ownership. If they want to go about it, who do they like? What are the steps to take? How do they go about it? And who do they go to? If they are an MCD, you mentioned, falling in love with the business side of it and wanting to take it a step further. Learning metrics, learning people, just learning everything about that office and running your own business. That's the beauty of Aspen, because you have that backbone. So if you do want to take it a step further and become an owner, what are the steps that you're supposed to take?
Yeah, so a couple things. First thing is it's the dating process. I say you've joined Aspen and let's date and see if this is the right fit for each other. Some of the doctors may not feel like this is the right fit for them, and we might feel like some of them are not the right fit, right? So hopefully after the dating process, both the doctor and us, we feel like, okay, this is the right fit. So what that means is doing the right thing for a patient 100% of the time, making sure we take care of our people and, we're nice to the patients and our people, right? And we also get the business. You're a good leader in the field and you get the business. So what it means is, you start working in your practices, you're doing great with your people, with the patients, and also you're being very successful as a business, as an MCD at that point. And so sometimes it's, the doctors don't realize, okay, they've gotten to that level, in which case the ops people might be like, hey doc, have you considered, what is your goal? What is, end goal? Have you considered ownership? Do you want to be an owner? Also, we have doctors who are pretty, okay, they know what they want and they come in knowing and telling us. And, so like I told you, okay, you need to have a basic idea on what profitability is. And just to give you a rough idea, I don't want to throw numbers, but just to make sure as a single doctor, I want to make sure that we are above 150 every month consistently. And obviously when the doctors are doing 180, 200, we know the business is really successful. They can handle the business side, because the last thing we want is you have student loans and everything, and we want to sell you a practice and you have this huge liability above your head. So we want to make sure before you go into ownership that you have few months running a business, you're successful. And so it's not going to hit you, when you buy your practice. And that's the key thing. So just roughly, most practices, you have to be above 150 to be profitable after paying finance fees and things like that. So some states it can be 180, based on things. So just making sure you're a profitable level. Then also, if you have multiple doctors, then those numbers differ. And the key for us is to make sure that you can run a business successfully and it doesn't hurt you if you buy it. Then we want to protect you as well.
Thank you, Dr. Pravin. I wanted to stay on compensation a little bit. We did get a question regarding compensation structure, and one of our newer doctors not knowing for sure how their compensation works. We all are aware of the guaranteed daily rate and then the profit sharing plan as well. So just go over what the compensation structure is supposed to look like, because as a newer doctor, some of them are still kind of a little bit unaware.
Yeah, so I can, so basically, we are Aspen Dental. We have an umbrella, but, individual owners, because the doctors are paid by the individual owners in the field, there could be different variations of contracts throughout America. I can go over an example of what a contract would look like. So I will go over my contract when I was, one of the doctors, probably, and we see this very commonly in most places. Okay, so there are two kind of contracts that you're going to see as an MCD and an associate. So basically, one of the best things about Aspen, if you go to different DSOs or even private practice, you get a percentage of what you make. And so there is a little bit of clash between the dentists within a building. You're trying to get the more expensive procedures so you can generate more revenue, and which is actually counterproductive. In Aspen, we don't care who does these procedures, which is more conducive of partnership. It could be the MCD who's doing big procedures, or it could be the associate. End of the day, the way we compensate is an average of production and deposit. So what we've produced and what we've collected, we take an average of that. We minus all of the expenses that are controllable. We call them controllable expenses because we don't put expenses that are like the rent and electricity and all the other costs. It's mostly just what the doctor is dealing with, like dental assistants, lab, hygiene, wages, controllables, like the things that we are purchasing. Some of those we minus that. And then we have a profit sharing plan based on your NPS. NPS is how much your patients like you and love you. So if you have a great NPS score, then the compensation is a little higher. So the model is based from 18% to 20% for MCDs and 8% to 10% for associates. That's one of the models that I'm familiar with. And like I said, there could be some variations based on where you're practicing and ownership and things like that. So we have the average of production and deposit, we minus all the controllable expenses, whatever stays, if your NPS is really, really high, then you get 20% of the profit sharing of all of it. And so what's the best part is not just what you do, but also the associate, the oral surgeon, the endodontist, and the hygienist. And trust me, like when I was practicing, my hygienist was producing around $60,000, which is phenomenal. 20% of 60,000 is a lot. So it is a profit sharing model of the entire practice, which so we just work together as a team and we are successful.
Thank you, Dr. Pravin. It's always good to get a refresher on the compensation structure. I get this question every single day, and it's pretty robust. It's very unique, and our doctors seem to love it as well. So thank you for that. We did get a live question. The question is, I don't know if you can see it on the bottom of your screen, but the question is, why is the sequence of procedures for denture fabrications in Aspen skip some steps like Fox plane measurement or final impression with PVS and custom trays? And then there's a follow-up on also, why is it common to do partial dentures without rest seat preps? So if you have, I think
so that
screen, so if you want to look at it again.
Yeah, we do a lot of things in dental school, but this is not just Aspen Dental. I know that question comes up, but that's kind of like private practice in dentistry in a lot of places. It's general practice to do some of these things, but Doc, end of the day, you could practice dentistry. We don't control on how and what you should and shouldn't do. We teach the ASAP technique. So the ASAP technique is actually a final impression. And, like a lot of times in the past, I've gotten challenged with using the ASAP technique, using the patient's denture as a base to take impressions. But what's crazy is as we're going into digital dentures, research and everybody who's practicing digital dentistry is actually using what we call the ASAP technique. We take impression using the patient's denture with a PVS impression material or an elastomer, which is a final impression material. And so to that question, I say, actually, like most places, we do take a final impression. We just do it one impression rather than take an alginate and then do a custom tray. We use the patient's denture as a custom tray to do it. And in places where you feel like they don't have a denture, you can tell your lab to fabricate a custom tray, or even what you could do is after taking the alginate impression, you could take a wash impression in the bite stage. So that way, if you feel comfortable getting that final impression, you could do that. Rest seat preparations, again, it's up to you who does it. And I came out of dental school similarly with that philosophy of rest seats and things. And I've seen partial dentures work for 15, 20 years. If you are someone who places rest seats and everything, I would say, go for it, place rest seats and have them take impression after you do rest seats. So the clinicians in Aspen Dental own the treatment plan and the treatment. So again, to reiterate that, we in Aspen don't tell you how you should and shouldn't practice dentistry. We give you guidelines and stuff. And if there's a certain way you feel like is comfortable, and this is how that is your standard of care, then, you feel free to practice that. We have a lot of experienced doctors who've done things in the past and they have some knowledge. So, my only thing is keep your, just keep yourself open to trying new procedures and things.
Great, thank you, Doctor. We did get a question that came in regarding CE that that Aspen doesn't necessarily offer. Who would the doctor go to for that? Would they go to their owner? Would they speak with operations if they do want?
I would go to the owner doctor when you have any concerns. Especially if you're with an owner doctor, the owner doctor is the one who's going to do all of the doctor related payments and things like that. So those are conversations you have with the owner doctor. And I know like a couple of my friends who are owner doctors, when we didn't have the implant program with us and they wanted their doctors trained, they took their doctors for implant programs and things like that. If it's a large group practice, the large group practice is a practice that doesn't have an owner doctor. You can reach out to the director and be like, hey, I'm interested in this. Is this something you can help me with? Or reach out to the clinical team, and then we can talk to the ops people to get your some of the information. We may have the courses in Aspen because, like we traditionally have speakers come to Aspen and do a public course for, our Aspen doctors. And if that's something that is in the pipeline, then we'll let you know, hey, just sit tight. In a couple of months, we're going to have this public speaker come and do for all of Aspen. So always reach out to us. And maybe it's coming down the line, or we can talk to ops to get you the training you need.
Great, thank you, Doctor. I wanted to touch upon this question. This is actually a great question from a doctor's perspective. This is one of the newer doctors that submitted this. What are some tips to show confidence to patients when you haven't built much confidence in yourself yet as a clinician? I love this question. This is also an answer that I can bring back to my students as well, because I've gotten this question multiple times as well, and that's why we like to have doctors with us to kind of answer this question from a clinical standpoint, right? So, Dr. Pravin, what are some tips that you have for that newer doctor that they're not 100% confident in themselves, but they want to show that confidence to their patients that they are able to, do these procedures, and they want the patient to be comfortable with it.
Yeah. some of the doctors, just are confident from the get-go, but if some people, I think practice is generally going to get you the confidence you need. The more you do stuff, the more confident you're going to be. Hopefully you have a mentor doctor that you can back on. But in general, that question is really, really important, because the patients are going to say yes when they start trusting you. But if they start seeing lack of confidence, and then there's going to be wavering trust, and then they're most likely not going to say yes to care. And so some of the young doctors want to start doing new patients and treatment plans right away. And so I told them, watch your mentor doctor do it for a while, because the new patient experience is the key, and you have to be confident, and you have to be empathetic and present it in a way they fall in love with you and they trust you, right? And so the key things that you could do, like if you are not confident, just fake it till you make it. That's my best advice, as in, like, there's nothing that's going to change overnight. The things building to that point is repetition, making sure you have the knowledge, knowledge of anatomy and all the things that you need to do a particular procedure well. So that's, profound. You have to make sure that you have enough knowledge to do that. And number two is practice. Even sometimes, even though you have the theoretical knowledge, actually doing some stuff, and when you're given a curveball, how you manage it. So as you do more and more, you're going to be really confident. It's going to show in your body language. But the key thing is, when I said fake it till you make it, even though inside you feel like, oh, the roof is crumbling, or the floor is crumbling beneath you, you just have to maintain and be composed, so the patient and your teams don't see it. And that's just a skill. It's going to take time to master everything and get better. And but I see some doctors, like, they just come in and they just confident and inherent in their capacity. Others have to work and make sure the more they do, the more confident they get.
Thank you, Dr. Pravin. On the flip side of that question, regarding some more of those complex cases that a doctor is able to do, for example, the cases that they are referring out to oral surgery and endo, are they allowed to do it, or are they just supposed to refer it out? Like, what if they are capable of doing some of those complex?
Yes, so that's the best part, right? Like, so one thing I would tell is, if you don't have the knowledge and you don't have somebody who is close by to bail you out, you have to be, like, I don't want to deter you from that. Make sure you have your knowledge first before you go into challenging cases, right? And not blindly taking up anything and everything. But I think most of the doctors graduating dental school have enough theoretical knowledge to go and push their boundaries. And to that question, if it was asked directly to me, I always push my boundaries. And if you heard me talk about earlier, I went from being an associate to an MCD within a month. And my analogy was a third molar breaking, which means it's the most complex extraction you can get, going and taking a wisdom tooth out. And so nobody is holding you back from doing stuff. But the thing is, you should know how to manage complications that can come, or knowing where to stay away from. Going into the lower, you're doing a third molar, knowing where the lingual nerve and artery is crucial. If you have to put a flap and raise a flap, things like that. So that's why I said, don't take something that, don't take a bite that you cannot chew, so that's very, very important. As long as you have the knowledge, there's nothing stopping you from trying and expanding. And in fact, I would encourage you to push your boundaries and take procedures that you want to, okay, I want to keep pushing my boundaries. So once you can do simple extractions confidently, then you want to go into a little bit more surgical. Once you can do all the surgical, then if you have an oral surgeon, I would say don't do wisdom tooth. But hey, if you want to know how to do it, there's nothing that's stopping us, as long as you know the knowledge, you have the knowledge on how to do it, and how, if complications come, how you want to take care of it. But my advice to you, when you do something that's outside your limit, make sure you have a mentor doctor that you can call and reach out to. And so I always had an oral surgeon that I could call. My buddy was an oral surgeon, and I'd be like, hey, if this happened, how do I get myself out of this? Like, if a root broke, or if it's something close, sinus is exposed, things like that. You just need to know how to get yourself out of situations.
Awesome. Thank you, Dr. Pravin. We did get another live question. They state, is it true we are now only limited to mono for new cases, or we have the option to treat with Invisalign if we choose to? Doctor, what's your take on that one?
So for me, this is how I view it, docs. We are stronger if we are united as a company in terms of, purchasing power and, profitability, things like that. And frankly, clear aligners are at a point where, the technology has caught up. Yes, Invisalign had a huge share of the market, but the patents have expired and it's opened up and everybody is into the game. And so we wouldn't have chosen a company, if it wasn't been battle tested, so to say. So we have good records and we have, like a lot of papers that were published. So it's a Dentsply product, which is amazing. So it is a very good product. And we would like for all of our, doctors to do model that's what we would like our doctors to do. And again, like I said previously, we do not tell doctors this is how you should practice dentistry and you're the leaders, you're the keeper of the culture. What we would say is if all of us are united in the way we do things, it gives us a leverage. Like recently we had an RFP for implants and we were able to negotiate, since all of us are doing Straumann, we go with Straumann. We are able to tell them, okay, we have X number of doctors doing it and X number of implants we're placing a year, and so we're able to do this. And so similarly, if we go with Motto, we're going to have that purchasing stuff. And so if individual doctors are doing Invisalign, what's going to happen is it's going to be a very small sector, a handful of doctors, and the cost is going to go up, which means the cost for the patient is going to go up. So end of the day, so we want to make sure that our patients can afford treatment. And so we want to give them, not only the best product, but also the best pricing. And frankly, at this point, apples to apples, because the technology is caught up. I think Invisalign, the cost of trays to order from Invisalign is almost double, which means we have to charge our patients more. And like if somebody said, this is what I'm going to do, we're not going to say absolutely no, but we would put in front of them the business strategies and the pros and cons and why we need to, why Motto is a better product for us and our patients.
Thank you, Dr. Pravin, for your insight on that. For some of that newer technology and equipment in the offices, who are doctors going to for that? If they want to request specific equipment, or if they want, are they going to their owner doctor? Are they talking with operations? Who are their kind of point of contact for that?
So when you have an owner doctor and you have to purchase something, so you have to understand anything that the owner doctor is going to pay, a portion of the fees to it. So when you have an owner doctor, it's really important to loop them and to build that relationship where you can have a one-on-one conversation. And usually it's going to be the owner doctor with the ops team making those decisions. Okay, is this something we need for our office? Is it going to be profitable? Make life better for the patients and the team? So some discussions. So anytime you have an owner doctor, my thing is, as a new doctor coming in, you need to build that relationship with your owner doctor. That'll be like really important. That'll help you in the long run, helping them understand where you're coming from when you go and ask for certain things. So it's always have that good communication with your owner doctor, but the owner doctor is going to work with the ops people to make those decisions, right? So, and second, if you're not in an owner doctor office, it definitely goes directly to the ops. So your director and DVP. So all these simple things, if you want to change the composite or if you want to get a different file, those are all expenses that you can take care of within the office. But we have certain expenses that are called CapEx, which are bigger amounts that we have to budget for and then purchase them. So those would go to the directors, regional manager. You tell the regional director, then we talk with the DVPs and we try to budget it if it's a big amount on purchasing those things.
Great. Thank you, Dr. Pravin. We're coming up on 5 minutes here. Wanted to kind of get to maybe one or two more questions. We did kind of, if you want to kind of backtrack towards the CE, you did mention all of the CE that we did offer. Do we have CE opportunities online, or is just in person the only option for them at this point?
No, so we have Blueprint Learning, which is our Aspen site, and you have tons of CE. So like, for an example, was the Continuum 1 and 2 of implants, which is housed in Blueprint. And I think each of them have about 24 or 27 CE credits, which is, pretty amazing. Like when I was in a time crunch to finish, I have multiple state licenses and I don't know which one is coming up. So I had to rush and I went through, it takes a while to do it. So if anybody wants it, it takes a long time to do it, but I got 40 credits just doing those two courses and I was all set for my renewals. So we have those, and we also have online Cs that where you come to Chicago for some of the programs. Once you have the new building, you're going to have a lot more hands-on courses to do that. And from time to time, like I said, we bring speakers for endo, crown and bridge, things like that. So that it's not only virtual, you also have live patient, or the other way around. It's not only live, but you have Cs online as well. And also we have Dr. Bicuspid. So all the Cs, we've partnered with Dr. Bicuspid. So all the Cs on Dr. Bicuspid are available for our doctors, all the free courses.
Awesome. Thank you, Dr. Pravin. Wanted to get to one last question here before we do wrap up. We do have a doctor that is interested in just doing maybe like a community service, or maybe any of Aspen's initiatives outside of their clinic. What does that look like, Dr. Pravin? How do they go about that?
So COVID has thrown a wrench on it, but we are a huge organization that gives back to the community, especially the veterans. And so actually we are having a day of service. If you've not registered, please ask your regional manager. And I think it's coming up, if I'm not mistaken, soon. So that's a way of giving back to the community. When I used to do the day of service, I got all the veterans come in and I would pick one or two veterans and I would do free dentures, complete extraction and insert that would cost them probably $8,000, $12,000. I would just do it for free. And I know a lot of the doctors used to do that. They pick some of the veterans and, a couple of them. The day of service, you do whatever you can that day, but then you pick a few people, you do it, and then they give discounts to some of these veterans so they can afford the care they need. And so we are huge about giving back. We have our own, we call it the Mouth Mobile. We stopped it during COVID, but the Mouth Mobile goes from state to state to state, and all the doctors in that region would come and they would offer their service free of charge. Also, what we did is we did international trips. We've gone to Haiti, we've gone to Peru. So we go all over the country to support the locals on a week-long trip where we give back to communities around the world as well. And we're going to start that in 2022, going around the world. And hopefully the Mouth Mobile gets started back up so we can give back. So we do a lot of these things. But if doctors are creative and they want to do something themselves, please reach out to us so we can give you the materials so that you could do some. So we encourage people giving back to the community.
Awesome. Thank you so much, Dr. Pravin. I just want to thank you for taking some time out of your busy schedule for this session and to talk to our new doctors. We got some amazing answers from you. We had some amazing questions that were submitted. So it shows that these doctors are really, really invested in their career, and they have questions, they have comments, they have concerns, and we have a support team that is specifically there for them for whenever they need them. So I want to thank you, Dr. Pravin, for taking this time out today. I want to thank you, all of our new doctors as well. I want to mention that we will be hosting one of these the last Monday of each month. So if you want to just hop on another one to join us again, please feel free. If you have any other additional questions that were outside of the session that we might have not gotten to, please reach out to Dr. Pravin. You can reach out to me as well. I'll point you in the right direction. You can also reach out to anyone on the clinical support team. You have your mentor doctor as well. You have
Miles, just quickly, can you send everybody my email address, or just so they have it? And
yeah,
like
absolutely.
I said,
Yeah, absolutely, Dr. Pravin. I will send that out to everyone who joined us here today. I'll actually send it out to all of our new doctors as well, so they all
Absolutely.
and they all have you as a resource to utilize. So please, thank you all again. Thank you, Dr. Pravin. Thank you all of our new doctors, and I'll see you guys soon.
Thank you, everyone, for taking the
Bye,
time of your
everyone.
busy day. Thank you.
All right, have a great night.